Hello everyone. Today I will discuss about remineralization of caries in restorative dentistry. The content is as follows. Now, what is dental caries? Okay, dental caries, it is a highly prevalent dental disease, and although its prevalence has declined in most of the developed countries, the disease still remains a major public health problem. So dental caries, it is a continuous process resulting from many cycles, many repeated cycles of demineralization and remineralization. Now, what are the signs of this caries process? There will be first molecular changes in the hydroxyapatite crystals which are present on the enamel surface. And what happens over a period of time, there will be a white visible spot formation. And then if it is not treated at that period, there will be eventually dentinal involvement and cavity formation. So progression through these stages requires continuous imbalance between the pathological and protective factors. Pathological factors such as lactic acid, okay, decreased quantity of saliva. There are so many reasons. There are so many secondary factors also present in addition to the lactic acid and in decreased production of saliva. So what happens, there is more amount of lactic acid formation. It will lead for decrease in the pH, decrease in the pH, that is acidic pH, which will lead for dissolution of the apatite crystals. The protective factors are like calcium, phosphate, and other mineral ions which are present on the oral fluid. Okay, so what happens if there is a continuous imbalance between the pathological and protective factors, which will lead for the formation of demineralizations. Now, understanding the process of demineralization as especially the remineralization, helps to salvage a tooth from being ravaged by a carious process. So remineralization allows a more effective conservative approach to demineralization process. Now, what is this remineralization? Okay, remineralization, it is defined as a process whereby calcium and phosphate ions are supplied from a source external to the tooth to promote ion deposition into the crystal voids, which are present on the demineralized enamel and produces a net mineral gain. Now, this is a picture showing the demineralization and remineralization cycle. So first is when there is a sugary diet, that is carbohydrates are taken, there is presence of acidogenic bacteria like Streptococcus mutans. They digest, and as a result of this, there is a byproduct formation, that is lactic acid, which causes decrease in the pH. Okay, decrease in the pH. So what happens when there is a decrease in the pH? Our nature, that oral fluid will try to release the phosphate ions onto the area where there is a decrease in the pH, try to neutralize or bufferify the pH by supplying the phosphate ions. So, or what happens when it supplies the phosphate ions? Okay, there is a undersaturations in the oral fluid because the phosphate ions are released from the saliva to that area where there is a deficient, where there is a decreased pH is there. So what happens? There is a hydroxyapatite crystals. They will try to compensate by dissolving themselves, and they supply the phosphate so that the oral fluid is saturated with the phosphate ions. So what under normal conditions, these all under normal conditions. So what happens automatically, there is supersaturation of phosphate ions in the oral fluid, and it is like a process of osmosis from the region of higher concentration to the region of lower concentrations. So the phosphate ions will move from the higher concentration from the oral fluid to the tooth surface where there is a deficient amount of phosphate ions are present. So this is the mechanism of demineralization and remineralization cycle. Okay. So this is one more picture showing pH in the as a descending order and pH in the descending order. So what happens between 6.8, suppose when you take when there is acidic pH, so hydrogen ions, they will react with the phosphate ions in the saliva and the plaque, and if the acid is not controlled, if there is a still there is increased acid production, that causes fall in the pH. And if pH is between it falls below 5.5, that is the critical pH for the hydroxyapatite crystals. So pH, critical pH is nothing but at 5.5 hydroxyapatite dissolves. Okay, so below 5.5 there is a dissolution of the hydroxyapatite crystals happens, and Fa is nothing but fluorapatite crystals. Okay, fluorapatite crystals is nothing but when the fluoride comes in contact with the apatite, it forms fluorapatite. So the pH, the critical pH for fluorapatite is 4.5. That is the pH where it dissolves. Okay. So if the pH falls, if the pH is continually falling, reducing down, there is this fluorapatite also dissolves. And finally, when suppose if the pH is it is like it is stopped and there is no more increase in the pH, and hydrogen ions are not there, are absent, the what to say, there is a what to say, the process will try to go for a repair mechanisms. So the pH will rise, yeah, the pH will rise, leading for here, yeah, the pH will rise, leading to the formation of a fluorapatite and hydroxyapatite crystals. Okay, and leading for the remineralizations. That is between 3 to 4.5 there is erosion happens, between 5.5 to 4.5 there is caries results, and the pH above 5.5 there is remineralization happens. And if it is still alkaline, still pH is increasing, means there are chances of calculus formation is there. Coming to the requirements of remineralizing agents, remineralizing, the ideal requirement is they should deliver calcium and phosphate into the subsurface, should not deliver any excess of calcium ions onto the to the surface, should not favor the calculus formations, should work at an acidic pH to stop the demineralization during the caries attack, should work in the xerostomic patients also, as saliva is not effectively stop the caries process, should be able to boost the remineralizing properties of saliva. That is, it should boost, it should facilitate the release of phosphate ions, fluoride ions onto the enamel surface. Now, these are the different remineralizing agents, that is fluorides, calcium phosphate based remineralizing agents, calcium sucrose phosphate, sugar substitutes, and hydroxyapatite. Coming to the fluoride. Fluoride, they say that it is a major role player in slowing the arrest and uh, in slowing and arresting and even the reversal of a dental caries progression. Fluoride reduces the decay of the tooth enamel by formation of fluorapatite and its incorporation into the dental enamel. The fluorapatite reduces the rate of tooth enamel demineralization, and it increases the rate of remineralization of the tooth at the early stages of the cavities. The mechanism of, coming to the mechanism of action of fluoride. So critical pH of fluorapatite, as I already mentioned, is 4.5, which is lesser than hydroxyapatite, which is 5.5. So fluoride being electronegative, they absorbs onto the tooth surface and attracts the positively charged calcium onto the tooth surface. So in an acidic environment, fluoride ions react with the hydrogen to form hydrofluoric acid. Hydrofluoric acid diffuses into the bacterial cell and interferes with the enzyme enolase. Okay, and fluoride binds to magnesium, which inhibits the conversion of 2-phosphoglycerate to phosphoenol pyruvate. Okay, so the main mechanism is fluoride decreases the surface energy of the enamel, reduces the bacterial adhesion, okay, increases the enamel resistance and maturations, okay, and improves the tooth morphology. Okay, so coming to these are the different forms of fluoride available in the form of foams, gels, mouth rinses, and varnishes. There are fluoride is mainly supplied or commonly delivered in the topical form and the systemic form. The topical forms are professionally applied and self-applied. Okay, so the professionally applied forms of fluorides are gels, foams, varnishes, mouth varnishes, okay, and self-applied are mouth rinses and dentrifices. So the fluoride levels of about 3 ppm in enamel are required to shift the balance from net demineralization to net remineralizations. Okay, so the APF gel, the concentration of fluoride is 12,300 ppm. Varnishes, Durafet floor protector, sodium fluoride, the concentration is 22,600 ppm, that is parts per million. Okay, mouth rinse is sodium fluoride, it is 900 ppm. Yeah, so the reason to seek alternative to fluoride is fluoride highly effective on the smooth surface caries. Okay, and its effect would be seem to be more limited on the fit and fissure caries. Although fluoride presents no problems when it is used properly, among certain parts of the world, there has been suggestion that fluoride exposure should be limited because a high fluoride strategy cannot be followed to avoid potential for adverse effects like fluorosis due to overexposure of fluoride. Now coming to calcium phosphate based delivery systems. So calcium phosphate based delivery systems containing high concentration of calcium and phosphate. They are available in the form of unstabilized calcium phosphate remineralizing system and stabilized stabilized form of amorphous calcium phosphate based delivery systems. So what to say now, unstabilized amorphous calcium phosphate based delivery systems, that is what happens is it is calcium salt and there is a availability of a calcium salt in the form of a calcium sulfate and phosphate salt, that is potassium sulfate. They are delivered intraorally, separately intraorally, or delivered in a product with a low water activity. So as calcium salts mix with the saliva, okay, they dissolve, releasing calcium and phosphate ions. So the mixing of calcium ions with phosphate ions to produce an ion activity product for amorphous calcium phosphate that exceeds its solubility product results in immediate precipitate of amorphous calcium phosphate, that is ACP, or in the presence of fluoride, that is ACFP, that is amorphous calcium fluoride phosphate. Okay, so now what is stabilized form of amorphous calcium phosphate systems? Okay, it is a biomimetic remineralizing system. Okay, so it is like using biological fluids. Okay, so the biological fluids containing high concentration of calcium and phosphate ions contains inhibitory ions such as pyrophosphate and proteins to ensure stabilizations. Okay, that means to prolong the duration of action. So these stabilizing proteins include casein in the milk and stator in the saliva. So ACP, CPP. Okay, so this is the ACP CPP. So this ACP CPP, it uses the casein phospho CPP to stabilize the casein phosphate, that is casein phosphopeptide. Okay, CPP is casein phosphopeptide. It destabilize the calcium and phosphate ions at high concentration. So, and it promotes the localization and supply of calcium and phosphate and fluoride ions at the tooth surface. Okay, and it causes the diffusion of ions into the subsurface enamel. So the main usage of the CPP, the main benefit of CPP, that is casein phosphopeptide, is it prevents the spontaneous transformation of ACP, that is amorphous calcium phosphate, at the enamel surface, increases the concentration of ions in the lesion, okay, results in the formation of a hydroxyapatite or a fluorapatite via the crystal growth. Okay. So coming to nanohydroxyapatite, nanohydroxyapatite. So what is this nanohydroxyapatite? Is what to say? This mechanism, this concept, they say that hydroxy, they have used carbonated hydroxyapatite nanocrystals having the size, morphology, chemical composition, and crystals which is comparable to that of the human dentine. They are the same size, shape, chemical composition, everything is similar to the human dentine. So the concentration of 10% nanohydroxyapatite is optimal for remineralizations. They can effectively penetrate the dentinal tubules and obturate them, and can cause the closure of tubular opening of the dentine with the plugs within 10 minutes, as well as regeneration of subsurface in a mineral layer. Okay, sorry, regeneration of the surface mineral layer by formation of a hydroxyapatite crystals. These adherent nanocrystals aggregate and grow into microclusters and form a uniform apatite layer on the demineralized surface. Coming to the bioactive glass. Okay, bioactive glass, the example is Novamine, which is containing calcium sodium phosphosilicate comprising 45% of silicon oxide, 24.5% of sodium oxide, 24.5% of calcium oxide, and 6% of lead oxide. So in the mechanism, how it acts is, in the presence of water or saliva, Novamine rapidly releases sodium ions. This increases the local pH and initiates the release of calcium and phosphate ions. These calcium and phosphate complexes crystallizes into hydroxycarbonate apatite crystals, which is chemically and structurally similar to biological apatite. So Novamine reacts with the saliva, allowing the So the main concept is, so Novamine reacts with the saliva, allowing sodium ions to exchange with the hydrogen ions, and it increases the pH. So at the elevated pH, there is calcium and there is the calcium and phosphate ions precipitation as calcium phosphate. And as this happens, as the precipitation happens, this calcium phosphate crystallizes to build a new hydroxyapatite like layer over the exposed enamel, exposed dentine, and this will go and deposit over there and closes the dentinal tubules and forms the hydroxyapatite layer on the exposed dentine and promotes the remineralization. Next comes the xylitol. So it is one of the number of non-sugar sweeteners permitted for use in words throughout the world. So what happens? The habitual usage of this xylitol associated with a significant reduction in the caries incident increases the remineralizations. So cariogenic bacteria bacteria processes xylitol very poorly, producing little acid, okay, that is lactic acid, and this causes decrease in the incidence and promotes the colonization of the less virulent strains of bacteria that can ferment the xylitol. So it is a novel method of delivering remineralization ions in combination with xylitol has been developed using sodium fluoride varnish. So this varnish contains calcium and phosphate salts that have been nano coated with xylitol, and this xylitol coating prevents the early reaction and produces a sustained release of remineralizing ions. So saliva exposure dissolves the xylitol and frees the calcium and phosphate ions. So this is example of xylitol, that is sodium fluoride varnish in combination with xylitol, which releases the calcium and phosphate ions. When the xylitol dissolves, there is a release of calcium and phosphate ions into the saliva, promoting the remineralizations. Now coming to the latest concept of remineralization, that is using the biomimetic concept. Okay, biomimetic concept. Now what is this biomimetic remineralizing of enamel and dentin? So this concept says that remineralization based on the epitaxial, that is deposition of the calcium and phosphate ions over the existing apatite seed crystals, okay, that is remnants of the crystals on the enamel surface. So remineralization does not occur in locations where these seed crystals are not there, okay, particularly in completely demineralized dentin due to unavailability of these seed crystals in those regions. So biomimetic remineralizations aims to backfill the demineralized dentin collagen with liquid-like amorphous calcium phosphate nano precursor particles, okay, that are stabilized by biomimetic analogs of non-collagenous proteins. Now coming to polyamide, okay. So what are these polyamide? Polyamide is nothing but they are the dendrimers known as artificial proteins, okay, which mimic the self-assembly behavior of amylogenins to form a similar structure, okay. They are used as an organic template to control the synthesis of hydroxyapatite crystals. So what happens is so these polyamide dendrimers modified with the carboxylic acid groups causes the crystallization of hydroxyapatite on the etched on the enamel surface, that is demineralized enamel surface. They act as an organic template on the demineralized enamel surface to induce the formation of a hydroxyapatite crystals with the same structure, orientation, and mineral phase of intact enamel in a relatively very short period. Okay. Next comes the self-assembling peptide. What is the self-assembling peptide? So the role of treatment with peptide is proved to be a combined effect of increased mineral gain and inhibition of mineral loss from the tooth. So the beta sheet forming peptides, that is P114, that self-assemble themselves to form three-dimensional scaffolds under defined environmental conditions, and it has shown that it nucleates the hydroxyapatite crystals. So the anionic groups of the P114 side chains attract the calcium, okay, attract the calcium ions, inducing the precipitation of hydroxyapatite crystals. Next comes the electric field induced remineralizations. So this technique to remineralize the completely demineralized collagen matrix within a very short period of time, so which is what to say, which is benefited, which is achieved, okay, in the absence of both calcium phosphates and the analogs with the help of electrophoresis technique. Thank you.